Alrighty, so good evening. We're gonna get ready to get started. We're gonna be going over some review questions to prepare for your upcoming state exam. If you have your exam already scheduled, or if you're in the process of planning to schedule, hopefully these questions will help you get familiar with what to expect. I'm gonna share my screen with you. If you have any questions about some of the questions that I have here tonight, let me know. You can email me or we can talk after I go through the questions. We have about 25 questions that we're going to go over tonight. And as we go through the questions, just answer the questions in the chat, and then we'll talk about if you have any questions about the rationale or if the question was wrong. We can talk about that after we go through the presentation. So let's get started. So we're going to start off with vital signs tonight. So the first question is, what is the normal range for an adult respiratory rate? Is it 8 to 12 breaths, 12 to 20 breaths, 20 to 30, or 30 to 40? So if you want to just put your answer in the chat, what is the normal range for respirations, with respiratory respirations? All righty. I see we have B, so let's check our answer. The answer is B, correct. It is, I'm sorry. The answer is B, 12 to 20 breaths per minute. Because your respiratory is what we're looking to measure your inhalation and your exhalation. So it measures adequate ventilation in adults and in children. So your next question, how long should you wait before rechecking a blood pressure if it is initially high? So if you're checking a blood pressure and it comes back high, how long should you wait? Okay, we have 10 minutes. Let's check our answer. The answer is 5 minutes. So you want to wait at least 5 minutes to ensure accuracy and to check for any potential fluctuation while you're checking for the blood pressure. So in this situation, it is C, 5 minutes. Next question. What does a temperature of 100.4 indicate in adult? Is it hypothermia, fever, normal temperature, or is it dehydration? What does a temperature of 100.4 indicate? Alrighty, we have B. Let's check our answer. It is correct, B. A rationale. So the rationale is a temperature of 100.4 is typically indicates like a low-grade fever, or it may suggest infection or something possibly occurring in the body, like an inflammatory process. Let's switch over to patient rehabilitation. So when assisting a patient with mobility, what is the recommended technique? So when you're helping somebody walk, what is the recommended technique? Do you complete the task for the patient? Do you minimize patient involvement? Do you minimize how much the patient is involved? Do you encourage active participation or do you avoid involving the patient at all? Okay, let's check our answer. It is C, so you encourage active participation, and that's going to be helpful with the patient gaining their independence while they're rehabbing. You want to make sure that if they are able to do whatever functions they can do independently, you want to really encourage that so they can maintain that level of function, if not improve that level of function. Next question. What is a common goal of physical therapy for post-operative patients? And what that means is what is a common goal for those patients that are recovering from surgery? Is it maintaining bed rest? Is it preventing movement, restoring range of motion, or limiting physical activity? What is the goal for someone who just had surgery already? Let's check our answer. It is C, restoring range of motion. So one of the biggest concerns that we have when somebody is having surgery, we want to make sure that we maintain their level of function. We want to make sure that they have range of motion and they have we optimize their recovery time. So we want to make sure we restore their strength and restore their range of motion. In occupational therapy, what is the primary focus? Is it administering medication, providing emotional support, helping patients regain ADLs, or monitoring vital signs? What is occupational therapy? What is the primary focus? Let's check our answer. It is C, helping patients regain activities of daily living. So we are focusing on making sure that they have improved enhancing their quality of life. They're able to do activities that, as far as like brushing their teeth, button up their shirt. So we want to make sure that as they're recovering and they're rehabbing back to their normal function, they'll be able to do those skills that they used to be able to do independently. Let's switch over to infection control. Here we go. What is the most effective way to prevent the spread of infection? What is the most effective way to prevent the spread of infection? Wearing gloves, using sanitizer, proper hand hygiene, or wearing a mask? Let's check our answer. It is proper hand hygiene. Wash your hands helps prevent the transmission of pathogens. Now, let me ask you another question. How long do you wash your hands for? If you want to put that in the chat, that's another question. 20 seconds. Thank you. I see that in the chat. 20 seconds. So when you're washing your hands, it's important that you lather the soap and wash for 20 seconds. When should personal protective equipment be worn? When are you going to be wearing PPE? When we perform surgery, when we handle hazardous chemicals, when there is a risk of exposure to blood or fluids, or only during night shift? Like, when do you need to protect yourself? Let's check our answer. When there is a risk of exposure to bodily fluids or infectious materials. So whether it be urine, drainage, stool, if you're going to be exposed to patients' bodily fluids, you want to protect yourself by wearing a gown and gloves. How should contaminated linens be handled? So if you're working with linens, how should that be handled? Do we throw it in the laundry bin? Do we place it in an open container? Do we leave it on the patient's bed? Or do we place it in a leak-proof bag or container? Let's check our answer. It is placed in a leak-proof bag or container because you want to make sure that we properly contain the waste and properly contain the linen so we can minimize the spread of infection. And also, you don't want to put it on the floor either. All right, let's switch it up again. Let's talk about some questions that have to deal with the patient abuse. What are signs of potential elder abuse? What are signs of potential elder abuse? Social withdrawal, unexplained injuries or bruises, improved mood, or enhanced appetite. What would make you be concerned about a potential elder abuse? social withdrawal, unexplained injuries, improved mood, or enhanced appetite. Let's check our answer. Unexplained injuries or bruises. If you start to notice injuries that you don't understand how it could occurred, there's a different type of pattern, there's an oddly shaped bruise, it may indicate potential abuse. So you want to make sure you report that to your leadership or your social worker. We are mandated reporters if we are suspicious of abuse. What should you do if you should expect What should you do if you suspect a patient is being abused? So this goes back to the question that we were just answering. What should you do if you suspect a patient who's being abused? Very good. Report your suspicions to an appropriate authority. Typically, it's going to be your leadership, your charge nurse, or even a social worker, depending on your healthcare setting. How can caregivers help prevent abuse? How can you help prevent abuse? Limiting patient interactions, avoiding eye contact with patients, maintaining open communications with channels with patients, or ignoring patient complaints. Let's check our answer. C, maintaining open communication channels with patients. So that open communication, it fosters trust and it makes sure that it helps the patient become comfortable with you so they can communicate any of their concerns or voice their needs so we can escalate that to proper leadership if we need to report anything. Let's switch over to body mechanics. What is the primary goal of using proper body mechanics? Why do we need to use proper body mechanics? Is it speeding up the patient care? Is it preventing injury to oneself and the patient, increasing patient discomfort, or reducing efficiency? Why do we need to use proper body mechanics? It would be B, preventing injury to oneself and the patient. So the purpose of body mechanics is to reduce the risk of injury for you as the employee as you're performing patient care. So you want to make sure that you limit your risk of injury. When transferring a patient, what is the recommended position for the caregiver? What is the best position for you to stand in? Facing away from the direction of the movement, facing away, which is A, B, which is going to be facing the direction of movement, C, standing still, or D, sitting down. What is the best position for you to be in when you are when you're transferring a patient? Let's check our answer. It is going to be facing the direction of movement. You want to face the direction which allows for better control and injury prevention while you're either transferring the patient from bed to bed or from wheelchair to bed. You want to face the direction that you're going in. How should heavy objects be lifted? How should you lift heavy objects? Using your back, using the back, using your arms only, using your legs and not the back, or using a twisting motion? How should you lift heavy objects? Let's check our answers. Oh, sorry. Using the legs, not the back. So you want to lift from your legs rather than your back because you want to minimize the risk of having a back strain. So you want to lift and bend from your knees and use your legs to help you support and lift heavy objects. Let's move into a hard subject, but it does have some questions on the exam, which focuses on death and dying. What is rigor mortis? What is rigor mortis? Is it a sudden heart failure, stiffening the body after death, respiratory arrest, or loss of consciousness? It is stiffening of the body after death. It is a natural postpartum phenomenon. So after they pass away, the muscles and the body starts to stiffen. So that is something that it not necessarily immediately sets in, but it does set in after a couple hours. How should a caregiver provide support to a dying patient? Do you avoid the patient's presence? Do you provide medical interventions only? Do you offer emotional support and active listening, or do you focus solely on their physical needs? How do you provide someone that is passing away? How do you provide support? Let's check our answer. It is C, offering emotional support and actively listening. So honestly, when you're providing emotional support and active listening, it provides comfort, especially if they're in distress, and it aids with the dying process. You also want to alert your team members just in case they feel discomfort. We're able to give them medications to keep them comfortable. What is palliative care? What is palliative care? Is it aggressive medical treatment? Is it care focused on relieving symptoms and improving quality of life for patients with serious illnesses? Is it focused solely on prolonging life, or is it providing curative treatment? Let's check our answer. It is B, care focused on relieving symptoms and improving quality of life for patients with serious illness. It's a holistic support where we're supporting the family and the patient, and we're addressing their physical and spiritual needs, especially if it's a terminal or chronic illness. Alrighty, let's switch up again. We're going into section 7. I wanted to keep it a little bit more diverse. So let's do anatomy and physiology. Let's see how you feel about the different parts of the body. Which organ is responsible for filtering waste products from the blood? Which one is responsible for filtering waste products from the blood? Is it the liver, kidneys, pancreas, or gallbladder? Waste products. Let's check our answer. It is your kidneys. So your kidneys act as the filter system of the body, and that's how you create urine and we excrete toxins from the body. So for your next question, what is the main function of the red blood cells? What do the red blood cells do? Do they transport oxygen? Do they fight infection? Do they produce insulin? Or do they regulate your body temperature? Your red blood cells, what is the main function? Let's check our answer. It is A, transporting oxygen. So they're responsible for carrying oxygen from the lungs to the through the blood to the rest of the organs. So it is very important that it transport oxygen to the rest of the body. And this actually is a very classic symptom if somebody is anemic or if they have low red blood cells, they do start to get short of breath because of the lack of oxygen in the blood supply. Alrighty, where does digestion primarily occur in the human body? Where does digestion primarily occur in the human body? Is it the stomach? And is the small intestine, the large intestine, or is it the esophagus? It is. Let's check our answer. It is your small intestine. So that's where most of your digestion occur, and that's where most of your absorption of nutrients occur. It occurs in your small intestines. Couple more questions. Which of the following is not a function of the skin? Not a function of the skin. Regulation of body temperature, production of red blood cells, protection against pathogens, and of sensation of touch and pressure, which is not a function of the skin. Your skin does not produce red blood cells. This actually occurs in your bone, in the bone marrow. So every other option you saw is a function of the skin, but they do not produce red blood cell. That actually occurs in your bones. What is the function of the respiratory system? What does your respiratory system do? Does it pump blood throughout the body? Does it exchange oxygen and carbon dioxide? Does it filter waste products from the blood, or does it help regulate your body temperature? What does your respiratory system do? It helps with the exchanging of oxygen and carbon dioxide. So the primary focus of your respiratory system is to help you breathe, help you facilitate that exchange, and help you exchange out the carbon dioxide and the oxygen levels. So I think that was our last question for today. So thank you for joining me. I hope that these questions were very helpful for you. I'm going to stick around for any questions you may have. Feel free to re-watch this if you want to review these questions. But again, I appreciate you for logging in. Um, you can subscribe to our YouTube channel. We have these question and answer. We do a live question every Monday. Every other Monday, we're doing CNA review. We have a couple workshops coming up at the end of the month, so we'll be sharing information with you about a couple of our workshops that we have coming up. And so I'm just excited about all of the new things that we have planned for this year, but I appreciate you joining in or re-watching this. Hopefully, this is very helpful, but there's other recordings that you can watch as well.